My name is Dr. Gita Sinha. I'm from the Department of Anatomy and Neurobiology. This is the second presentation of the head and neck series. In this presentation, I will be talking about the anatomy of the facial nerve and the muscles of facial expression. In the first part, I'll be demonstrating the facial nerve, its branches and distribution, and in the second part, I'll be showing you on a prosection the muscles of facial expression. Let me demonstrate the course and the branches of the facial nerve on this skull model. We look here, this is your mastoid process, and on the medial aspect of the mastoid process is the stylomastoid foramen where the nerve exits from the skull. It proceeds towards the face, and in the face, in the substance of the parotid gland, it gives 5 terminal branches. The first branch which we see is the temporal branch. The second branch which is given is the zygomatic branch. The third branch is the buccal branch. The fourth branch is the marginal mandibular branch. And the fifth branch is the cervical branch. On this prosection of the face, I'm going to demonstrate the 5 branches of the facial nerve, and I will use first the landmark, which is this fatty looking area. This is the part of the parotid gland. The facial nerve passes through the substance of the parotid gland and divides into 5 terminal branches. And these branches are the, if I put my hand here and show the 5 branches, that represents the temporal, the zygomatic, the buccal, the marginal mandibular, and the platys and the cervical. Let's start with the first branch here, and I'm going to hold this nerve here, which is the temporal branch. You can see the branch goes towards the frontal muscle. The second branch, which I am holding in my probe, is the zygomatic branch. It comes towards the eye when it divides into 2 branches, superior and inferior divisions. Superior division goes up and the inferior division goes down and supplies the orbicularis oculi muscle. The third branch, which we are seeing here, few number of branches, these are buccal branches, and they supply the elevators of the lip and the muscles around the mouth, that is orbicularis oris. The fourth branch, which I am holding in the probe at the margin of the mandible, is the marginal mandibular branch, which supplies all the muscles which depress the lip or the angle of the lip, or also supplies the lower part of the sphincter around the mouth. The last branch, which I'm holding going to the platysma, is the cervical branch. On this model, I'm going to show you the muscles of facial expression. These muscles are very important in our day-to-day functioning. The first muscle I'm going to show is the muscle of the forehead, and that is the frontalis muscle. It covers the forehead, and it's important in raising the eyebrow. It also causes the wrinkling of the forehead. The second muscle is the muscle which goes around the orbital fissure, and it has 2 major parts. The orbital part is the one which surrounds the orbital margin, and the palpebral part covers the tarsal plates of the upper and lower eyelid. The orbital part, when it contracts, it squints the eye and it protects it from the glare and the dust. The palpebral part, when it contracts, does the soft blinking. Now I'm going to demonstrate the muscles around the mouth. The muscle which runs in the circular fashion around the oral fissure is known as orbicularis oris. And this muscle, when it contracts, it puckers the mouth and used in the whistling. The muscle which elevates the lip, there are two muscles. We look at this muscle here. This muscle is called levator labii superioris. When it contracts, it raises the upper lip. There is a thin muscle which we are looking here, coming to the angle of the mouth. This is known as levator anguli oris. Contraction of this muscle brings the angle of the mouth upwards. Now we are looking at this muscle which is coming from the zygomatic bone to the angle of the mouth. This is known as zygomatic major. This muscle, when it contracts, it brings the lip upwards, especially with the grin, gives the big grin. The depressor of the lips, there are two muscles. This muscle which I am looking at this moment is known as depressor labii inferioris. And when it contracts, it brings the lower lip downwards. The triangular muscle which you are looking here right now, from the corner of the mouth to the mandible, this is your depressor anguli oris. When it contracts, it brings the corner of the mouth downwards and makes it the sad face. Lastly, I will look at this flat, broad muscle which covers the anterolateral part of the neck. The anterior edge is here. This is the posterior edge of the muscle. This muscle is called platysma. Platysma is the muscle which stretches the skin over the neck and used in shaving. So this is a muscle for the shaving. The first muscle which we look here, the fibers which are going from the upper part of the orbit, and it's sort of this muscle which goes and attaches onto the epicranial aponeurosis. This is your frontalis muscle. The fibers covers the whole forehead. This muscle is supplied by the temporal branch of the facial nerve. The function of this muscle is to raise the eyebrow. The second muscle which we are looking around the eye, the fibers which are going in a very circular fashion, is the orbicularis oculi. It has two major portions. The palpebral part covers the upper and the lower eyelid. The fibers are running from medial to lateral. And these fibers, when they contract, they do the soft blinking of the closing of the eyelids. The orbital part, which goes in a circular fashion, is when it contracts, causes the squinting of the eye. This muscle is supplied by the zygomatic branch of the facial nerve. The muscle which goes in an orbital fashion around the mouth is known as orbicularis oris, and this muscle has got a sphincteric function around the oral fissure. When it contracts, it's almost like a purse string, and when it contracts, it puckers the mouth, and it's used in the whistling. The muscle is supplied by the buccal branch of the facial nerve. There are other dilators of the lips which come and insert into this muscle just like the spokes of a wheel from the lower part or from the upper part of the lip. And those are the elevators and the depressor of the lip. Let's look at the elevator of the lip. The muscle, we can see few fibers in here. This muscle is known as levator labii superioris. And this muscle, when it contracts, it raises the upper lip. The muscle which we are looking in on this side, it's attaching to the corner of the lip. This is known as levator anguli oris. This muscle, when contracts, it raises the corner of the lip upwards during the smiling. These two muscles are supplied by the buccal branch of the facial nerve. Now we look at this muscle which is coming from the zygomatic bone to the corner of the mouth. This is your zygomatic major muscle, and that muscle is a powerful elevator of the corner of the mouth and helps in laughing, sometimes referred as the laughing muscle. It's supplied by the buccal branch of the facial nerve. Now we are going to look into the depressor of the lip, and the muscle which I am holding right now, coming from the lower part of the lip to the lower part of the mandible. This is your depressor labii inferioris, and this muscle this is the triangular muscle which I am holding now in my probe. It's a triangular muscle coming from the angle of the mouth to the lower border of the mandible. You can see this is the anterior boundary of this muscle and the posterior boundary of the muscle. These two muscles are supplied by the marginal mandibular branch of the facial nerve. The last muscle, which is not well dissected here, is the part of the platysma, which we see here, only a small portion of it. And lastly, I want to talk about the buccinator muscle. The buccinator muscle is a quadrangular thin muscle which lies much deeper than the other facial expression muscles, and this is accessory muscle for the mastication. The fibers, they originate from the mandible, they pass forward towards the alveolar process of the maxilla. That's where they attach. You can see the upper margin of this muscle and the lower border of the muscle. This muscle, apart from helping into the mastication, this is the muscle which is important for blowing. So especially in the trumpet player, this muscle is well used. In certain point, it can be used that it becomes very thin, and when in the trumpet players, you can see the ballooning of this muscle onto the cheek. This muscle is supplied by the buccal branch of the facial nerve. Two important clinical notes which I would like to bring at this point of time. The paralysis of the facial nerve causes the paralysis of the muscles of facial expression. You will see the patient who will be unable to close his eyes. There will be expressionless face, dribbling of saliva, and also they complain about lodging of the food between the cheek and the gum line. Another important point which I want to bring with is the raccoon eye. The raccoon eye is the sign which you see with a blow on the frontalis muscle. The frontalis muscle has a fascia which attaches to the zygomatic bone. So dribbling of the blood collects around the eye and it creates an appearance like raccoon's eye. Now I'm going to demonstrate the parotid gland and its duct and other structures related onto the face. Let's see the extent of the parotid gland. Now this structure which I'm sort of going into the outline, this pinkish structure occupying the anterolateral aspect of the face is your parotid gland. This is the superior end and this is the anterior edge of the parotid gland. The parotid gland has got a very thick capsule and it is traveled by the facial nerve, the external carotid artery, and the retromandibular vein. The parotid duct starts the anterior border of the gland. It crosses the face and dips down into the buccinator muscle, which it pierces to open in the oral cavity. It opens opposite the second maxillary molar tooth. Now we are going to look at this artery which is coming out from the parotid gland, and this artery, and there is this divides into the parotid gland into two terminal branches. This is your external carotid artery. It divides into the maxillary artery and the superficial temporal artery. We won't be able to see the maxillary artery, but we will trace the superficial temporal artery, which gives branches into the scalp to supply the skin, the muscles in this area. This is the superficial temporal, the vein, and the maxillary vein forms the retromandibular vein, which we can see here, the part of the superficial temporal vein here, and we cannot see the formation of the retromandibular vein. We also, if we come towards the anterior part of the ramus of the mandible, we see a pad of fat. This pad of fat in the later stages, in the older age, this disappears and creates a sunken appearance of the cheek. Looking at the blood supply of the face, the artery which supplies the most of these muscles and the area of the face is the facial artery. I'm holding the facial artery at the mandible. It's a branch of the external carotid artery, and it enters the mandible anterior to the masseter muscle. Most of the time you can feel the pulsation of this artery if you press anterior to the masseter muscle at this against the bone. It has a very tortuous course, and it comes from the lower part of the face and ascends up towards the corner of the medial corner of the eye, where it changes its names and it becomes the angular artery. Here, posterior to the artery, we see this flat structure which is the facial vein. This is an important relationship you should note at this point. The artery lies anterior while the vein is lying posterior to the artery. The facial vein is formed by the angular vein at the medial canthus of the eye and descends down, collecting the other veins, and then it goes and drains into the internal jugular vein. While I am talking about the venous drainage of the face, on the clinical note, I would like to talk about the danger area and the spread of the infection. There is certain area into the face which is this triangular area, which is sort of comes at from the bridge of the nose all the way to the upper lip. In this area, the infection from the veins can travel to the cavernous sinus. And there are two different routes which I would like to talk about. It can go from the angular vein into the inferior ophthalmic vein which lies inside the orbit, and then it reaches to the cavernous sinus. Or it can go from the facial vein and reach to the pterygoid plexus of vein, which lies much more deeply placed in the face. From there it can pass to the inferior ophthalmic vein and to the cavernous sinus. The first question is identify the structure marked by pin A. Question number 2. Give the nerve supply of structure A. Be specific. Identify the structure and be specific. Question number 4. Where does this structure drain its contents? Question number 5. Identify this structure. Be specific. Question number 6. Identify this structure and give its nerve supply. Question number 7. Identify this structure. Question number 8. Identify this structure. Question number 9. Give me 2 routes through which the infection from this area will reach the cavernous sinus. Question number 10. Identify the structure near my probe.